All right, welcome to Full Circle's Pregnancy Orientation webinar. Sorry, we are running a couple of minutes behind. We're going to jump right in. My host is going to start sharing their screen. Please raise your hand if you're able to hear me and able to see their screen. Okay, fantastic. I see some hands going up. Okay. All right, maybe I don't. Okay, okay, I see some hands going up. Fantastic. Couple housekeeping items first. One, this is confidential. So you raised your hand, nobody knew who you were raising your hand. And no one will know who you are if you ask any questions either. So please feel free to participate and ask questions. I have some poll questions hidden throughout here to just kind of keep you engaged and listening. And then if you have to hop off in the middle, I understand it's dinner time. Just know that all of this information will be located on our YouTube channel. You will receive a link to watch this later on, sometime this weekend. So we're going to start with a poll question. And this is how they will go. I want to know who's on the line first. So, do I have more veteran mamas on the line or first time moms? So, I'm going to give you a couple of seconds. You're going to answer your poll, and I'll say 3, 2, 1, polls are closing. Boom. All right, so this time we have more mommy veterans than first-time moms. So I happen to know a couple of people who are on the line right now. It's not your first rodeo, but it's been a minute. So this is a nice refresher of what happens in pregnancy at Full Circle. So we're going to talk about the Full Circle experience, which includes where we deliver. We're going to go through some of our office protocols, talk about what to expect at your pregnancy visits. I'm going to give you a lot of prenatal resources. We'll talk about exercise and nutrition in pregnancy, and then wrap up with a quick COVID-19 update. All right. So I have one person saying that they can't hear me. Double check your volume because I think everyone else was saying that they were able to hear me. And if it's a problem again, you can catch me on YouTube afterward. All right. So, all right, fixed it. Awesome. Let's start out with some information on the basic philosophy of our practice. So, Full Circle is based on the collaborative midwifery model, which operates under the premise that pregnancy and birth are normal life processes, not a disease process, like something we have to cure you of. So, in the traditional midwifery model, we care for normal, low risk women. But if you develop an abnormality or complication with the pregnancy, like too much fluid, or breech baby, or high blood pressure, high blood sugar, you may have to transfer out to access physicians for a different acuity of care. In the collaborative model, though, you're still able to stay in the care of the midwife. So, they're still doing your prenatal visits, but they get physician direction to guide them on any abnormalities, anything that's not normal and physiologic. So, to that end, the majority of our vaginal deliveries are attended by our certified nurse midwives. So, you'll get to labor with a midwife still. Now, I know some of you started out as my GYN patient or Dr. Marrow, Dr. Mooney's GYN patient. You're like, oh, I'm just going to transfer over and have my doctors deliver me. Only if you have something abnormal about your labor. So if there's something outside of the scope of our midwives, they call us for consultations. If it is something emergent, where we deliver their OB hospitalists, their board certified OBGYNs who are in-house 24 hours a day for true emergencies, like you don't have 15 minutes. If it's something urgent, meaning not a true emergency, but something that can't wait until morning, all of us live about 15 minutes from the hospital, and they can get one of the Full Circle physicians in to see you. To put it in perspective, we did nearly 550 deliveries last year. Only 3 times did we need the OB hospitalist for an emergency. And most times, honestly, the emergency is that the baby's coming out. It's not anything bad. It's just nobody's there and we need someone to catch the baby. So there aren't as many true emergencies as you would think. And so even if they do call the hospitalist, one of us is still en route to finish taking care of you. And we're typically there right about the time the baby's being born. So where is there? Great question. We deliver at HCA Florida, which is on University, less than 10 minutes from the office. They are doing tours. So they have stork tours, which are like huge baby showers that they do every quarter. And you're able to go up and tour the unit, meet the nurses, see labor and delivery and the postpartum floor. But if those don't fit with your schedule, then they have one-to-one tours available. So when you come in for your prenatal visits, on the walls, they have a schedule of the upcoming stork tours. Take a look at it. And again, the phone number that's on there, if the stork tour doesn't fit you, they do them every day. So on the weekends, they do them in the evenings, whatever they need to do to accommodate you and your family being able to see where you're going to meet your little ones. So please feel free to reach out to them for that. Our office hours, we are open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch from 1 to 2, and then we reopen from 2 to 5. So if you call between 1 and 2 and you get the after hours message, that is intentional. The phone is not broken. We use the after hours line during lunch in case someone has a medical emergency between 1 and 2, because the after hours line rolls over to the on-call provider. Now, she's the on-call provider, so she's in the hospital taking care of hospital stuff. So please don't leave a message regarding administrative things between 1 and 2. Please give us a call back at 2. On Fridays, we're open from 9 to 1, and then we close for the weekend. So if you are calling about something administrative at 12:57 on a Friday, that may be responded to on Monday when we reopen, or Tuesday if it's a holiday. We also do not have walk-in appointments. Our goal is to see you as close as possible to your appointment time, and we can't do that if we promised you the 2:20 spot and someone walks in at 2:19 saying, I need to walk in. I have something that's really important, but that's this other person's time. We do have some same-day appointments. Sometimes people deliver and an appointment slot clears up or people have to cancel. So if you're calling in saying, hey, I think I need to be seen today, we will say, hey, we have a spot open at whatever time and try to slide you into that space. If there's something urgent, like say you're calling at 9:30 and you're saying, hey, I'm really concerned about this, and our only open spot is at 3:40, we don't think you should wait 6 hours, in our lobby or waiting for someone else to cancel. So we may say, hey, we think you need to go to the hospital for that, or we need to send you to urgent care. It's not us saying that we don't want to take care of you. It's us saying that we agree this is an urgent matter. And because we don't want you sitting in the lobby waiting to get worked in, you need to go someplace where you can be seen urgently and in a timely fashion. When you call to the office, providers are not able to leave appointments to take phone calls. Again, this is us trying to respect the time that we promised to you for your appointment. If I promise you the 11:40 spot, you have my attention for that entire spot. It's not fair to you if I leave your appointment to go talk to someone else because at 11:37 they decided I have a question. We do have a nurse who is able to answer the majority of OB questions because many of them are recurring questions. And so if there's anything outside her scope, she knows how to reach out to the provider on call or someone who's in the office to get you an answer in a timely fashion. If you are calling, you do have to leave a message in order to receive a call back. And please be sure you're leaving your message with the right person. So for issues like nurse visits, if you're not sure about the baby's movements, you may be having preterm contractions. Tony is our nurse, and she also takes care of letters and forms like FMLA and short-term disability. She's your contact person for that. Our OB clinical coordinator is Naisha. So she handles referrals like for high risk or cardiology or hematology. If you need to have lab work done, many of you have already gotten an email from her to get your regular prenatal lab orders. If you have to have something scheduled like a delivery or a version, and I believe everyone on the call to whom it applies has spoken with Renee Hall, our benefits coordinator. So she's the one who checks your insurance. So if something changes with your insurance, I think almost everyone on this call is going to be pregnant into the new year. So if you change policies or something changes about your deductible, please update Renee so that we can make sure that we're still on the same page about what your benefits are and what's covered, because we don't want to continue collecting unnecessarily, having to give you back money later on that you could just keep. Please, again, be sure you're listening to where you're leaving the message. It freaks our biller out when you leave him messages about your mucus plug. So please be sure you're leaving your message with the person who can answer it appropriately. After hours, there is always someone from our practice on call for our practice. That's the emergency on call line. So you just call the regular phone number that you always call and follow the prompts to reach the on call provider. This is who you call if you think you need to go to the hospital. And you have to leave a voicemail message for the phone to even register that the call came through. So this isn't the phone call for, oh, I forgot what Jane said in my visit today. Let me just call and have them read it back to me. This is, nope, I think this baby is coming and I need to come to a hospital. If you call, remember, this is the person who's always on call, who's also in the hospital. So they may be in the room pushing with the patient. If you feel like you need to come to the hospital, come on in. Like, don't have your baby on the kitchen floor because Jane wasn't able to call you back. If you come on into the hospital, you're very likely to see the person who's supposed to call you back. So just if you're not able to get through for whatever reason, it is a cell phone. Sometimes towers go down or what have you. Just go to the hospital. There's always somebody there who can let us know that you're there and evaluate you and get you the help that you need. The patient portal is another way to reach us, but please remember response times can take up to 2 business days. So if you send a message on a Thursday, the next business day is Friday and the next business day is Monday. So if you are sending a message on a Thursday, just be sure it's something that can wait up to 2 business days. You'll also, I think the next thing is if it's a non-action item, it will be answered at your next visit. So if you're just calling to ask whether you're prenatal, if you can switch prenatals or something like that, that is not urgent, then that's something that we may pass to the person who's going to see you at your next visit, because we're going to be seeing you very soon in the office in general. The portal is best used for things like losing your lab slip. So if it's something that you need to accomplish before your next visit and you need another copy of it, we're happy to send that out to you. Say you contracted a cold or some other upper respiratory issue and you know that we're a well office and you're trying not to come in and get everybody else sick. Thank you so much. Let us know that way, as long as there are 2 business days between the time you send the message and the time your next appointment is supposed to be scheduled. We'll typically convert you to a telehealth. We ask that you do not send emergent things in the portal. Remember, 2 business days. So if your blood pressure is high, if you're not feeling your baby move, if you're having heavy bleeding, that is not a message for the portal. Please call the on-call provider or please call the office and speak with the nurse who's on call who can help you with that. We also ask that you don't send blitz messages, meaning that you start a message and then Lauren doesn't respond in 2 hours, so you send it to Jane, and Jane doesn't respond in 2 hours, so you send it to Dawn. We have people get very upset because they go to the pharmacy and there are 5 prescriptions waiting there for them. But if you message 5 people, one, it's not an efficient use of our time, and two, it can get confusing for you to get multiple responses. Also, if you're cutting and pasting messages to different people, then the system may think that you are a bot trying to spam us and delete your portal account, and that's really hard to reinstate. We also ask that you please don't attempt to have an appointment via the portal. So if your portal message ends in, what are your thoughts about this? That's an appointment. So the portal, again, after we've seen patients all day, done all our charting, reviewed all our ultrasounds, reviewed all our labs, we want to spend time with our families. We don't want to do 20 more mini appointments in the portal. So if you have questions, something that you want to discuss, articles or what have you, start a text thread with yourself. Text yourself questions so you can bring them to your next appointment, or schedule an appointment. We're here during the day and happy to talk through whatever it is you have questions about. All right. Ultrasounds are also released via the portal. So we send out our ultrasounds after you've left your appointment, unless there's something urgently abnormal about your ultrasound. Our sonographers have been doing this for decades, and they know what things shouldn't be allowed to just walk out of the door without a plan. So that is the one time that we will break in our schedule. You'll talk to somebody. We'll have you in a room until we're able to sit and explain it to you and make a plan. Otherwise, the sonographers create their report. They upload it to our electronic medical record system. It's divided among the providers and they send it out to you. and you'll get it within 2 business days. So sometimes you'll see the sonographer typing away at the bottom of your report and it freaks you out. You get in your car and you send a message, "What's on my ultrasound report?" The answer will usually be, "We don't know yet," because we still have to get the report ourselves. So it's just like we sent you out to another facility. Give us a chance to receive the report, review it, and release it to the portal. If you know that your anxiety is not going to let you wait 2 business days to find out what's on that report, please make an appointment the same day as your ultrasound, because that way the sonographer can print out a preliminary report and she can give it to your provider and she can go over any important points that you may have questions about at that time, and then you'll get the full report within a couple of business days. The other portal that exists is Quest, and they are kind of annoying because they send the results to you before they send them to us. And then you get the results and you see all this red and it freaks you out and you start sending messages and you attach all the labs. So just remember, when you see red on a report, it doesn't necessarily mean it's abnormal. The reference ranges, the ranges they use for normal are for people who are not pregnant. So when you are pregnant, there are some physiologic changes that make it okay, whatever the out of range number is. So give us a chance to receive the labs from Quest, review them, and release them to you. Please don't upload the labs in your portal, because then it won't close our loop of us sending the message to Quest and them receiving it. And it will still show as we have an outstanding lab if we reviewed it from you and not from them. Now, if you've had the lab for over a week and you haven't heard anything from us, there's a chance Quest didn't send it to us. So in that case, please do feel free to send it to the person who ordered it so we can reach out to Quest and get it from them. Again, you don't have to upload your copy. We will get it from the lab and then we'll send it out to you. But give us a chance to get it and send it out to you. When you go to the lab, please use the same name that you use at our office. I know it sounds really basic, but sometimes y'all are like secret agents sometimes. You have 4 or 5 different names. And the most common reason that we don't have your labs is that they're actually here, but they haven't connected with your electronic chart because it doesn't recognize your name, and so it doesn't sort electronically to you. So we want your name to match the insurance as well. And if you're using a different name, we can almost guarantee it's going to delay us getting the results and thus us getting the results to you. Question I have out here is, do you only work with Quest or LabCorp as well? No, we work with LabCorp also. This is actually for any commercial lab. Any place you go, please use the same name across the board, and they will all send the results to us and we'll send them out to you. Good question. I use Quest a lot because they are the biggest culprits of not sending us labs. Any other questions on communicating with us? All right, fantastic. Next, I believe we have prenatal visits, what to expect? Yes. All right, so first thing to expect is that you are going to forget all of your questions when you come in for your prenatal visits. So please start that text thread with yourself. Text yourself questions as they come up in your head so that when you come in for your visit, my favorite thing is when I finish my part of the visit and the patient's like, "Okay," and she pulls up her thread and she starts telling me what she wants to talk about. You're going to wear loose, comfortable clothing so that we can access your belly, because at every visit, we are going to listen to your baby's heart rate. That's not necessarily an ultrasound, but we are going to check on the baby with the Doppler at least to hear the baby's heart rate. We ask that you arrive about 5 minutes ahead of the scheduled appointment time so you can check in and handle any insurance things at the front desk and leave us a urine sample if you need to. The American College of Obstetricians no longer says we have to routinely check urine on everybody. So if we're following your urine for protein because of high blood pressures, or sugar because of blood glucose, or if you had a recent urinary tract infection and we're checking a test of cure, you will know, or front desk will know, if we need to get a urine sample from you. Otherwise, we know you're pregnant, you've been driving and drinking your water. I hope you're drinking your water. And you need to go to the bathroom. So when you come in, please go so that we can have you in the appointment room at your appointment time to be seen by your amazing midwife. All right, next. If you are more than 10 minutes late, we'll have time to check on you and the baby, which typically means we can do a blood pressure check and we can listen to baby's heart rate. But that obviously leaves a lot less time for your text thread questions. If you're 20 minutes late, you have missed the entire appointment slot. If there's another open space very close, front desk is really good about saying, ooh, she's going to miss that 220. Ooh, but I see there's a 240 over here. And they'll try to work you in. If that's not possible, we may be able to work you in even later in the day or reschedule to another day or time that works for us all mutually. Diagnostic ultrasound visits. So the other question that I get is, when am I getting another ultrasound? Great question. Diagnostic ultrasounds are separate from prenatal visits. So the way to know if you're scheduled to have an ultrasound next is to look at your portal. Do you have more than one appointment time? Is there a provider's name associated with your visit? So Tina Test, my imaginary patient here, clicks onto her portal and she looks at appointments. And Tina realizes that she has two appointments on the same day. One is at 9:20 with ultrasound, which is not a provider's name. The next is at 10 a.m. with Dr. Yeckel, which is a provider's name. So Tina knows, hey, I'm getting an ultrasound this day. Let me tell my family to come hang out with me at 9:20. And then if they're able to, they can stay for my appointment with Dr. Yeckel at 10 o'clock. If you don't see ultrasound on that day, then you are not scheduled to meet with one of our sonographers or techs to have an ultrasound visit. If you think you're supposed to have one, please let the front desk know before you arrive because their schedules fill up just like ours do, and we schedule them ahead of time, and we don't have walk-in, work-in ultrasound visits typically. Remember that the ultrasound results are sent to your patient portal within 2 business days. You'll get those results then unless there's something urgently abnormal, in which case we will discuss those findings on the same day. So when you're checking out from an appointment, if your midwife has said, hey, it's time for you to get an ultrasound in a couple of weeks, when you go up to the front desk, please be sure that they are scheduling 2 visits, both a prenatal visit, a regular visit with one of the midwives, and an ultrasound visit with one of the sonographers when it's due. Now, if you're not due for an ultrasound, but you're like, but I just want to see my baby, Dr. A, hey, that's what boutique ultrasounds are for. So there's a couple of places on here. I know there's at least one couple that's on today that we talked about this. They do really cute little ultrasounds, gender reveal packages and stuff. So the ones I have listed here are for informational purposes only. There are a couple more around the city. So just find one that's close to you. They do stuff like put the baby's heartbeat in a stuffed bear, and they do 3D, and you can have your whole family in for some of them in theaters. So just know that boutique ultrasounds are a thing. They are safe. It's not radiation. If you want to just go and take a look at your baby, but you don't have a medical reason to do it for a fun reason. All right, so our poll question is about, guess what? Ultrasounds. That's right. So when can you expect to have a routine ultrasound? Will you get an ultrasound at every visit? Will you get an ultrasound at 20 weeks at your due date? And if you go past 41 weeks? Or do you only get ultrasounds if you have problems? And the polls are closing in 3, 2, 1, done. That's right, 20, 40, and 41 plus weeks. So your routine anatomy ultrasound is around 20 weeks. If we see everything we need to see, you are normal. We don't need to look again unless you develop any concerns or you go past your due dates. Awesome. Okay, we are headed over to the website now. So we're going to go to fullcirclejacks.com. And you'll see that pop up on your screen right now. And we are going to start with the providers. So those of you who delivered with us before and we're in a new facility, if you missed the town hall regarding our move to Florida HCA, back there on the home screen, there was a banner you can click on to watch the town hall and find out why we moved. Next month will be a full year that we've been there, and it's been amazing, a fantastic move. Patients, everybody's very happy. All right, so back to the providers. One of these lucky ladies will be fortunate enough to join you and your family in welcoming your new little one or little ones. So there's me, there's my partner, Dr. Marrow, there's Dr. Yeckel, there's Dr. Mooney, and then midwives. We have midwife Lauren, midwife Krista, there's midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And we will be adding yet another midwife coming up in January. So full circle grows again. The next question I have is, what about frequency of ultrasound for twins? So twins are a special case, and I think we talk about twin ultrasounds like in your personal visit, but typically we do twin growth after your anatomy ultrasound. That's not a routine thing. Not everybody has twins, so that's not a routine ultrasound. That's a special ultrasound for twins. All right. So here at the top of the page, we're going to go to patient information. You'll see the obstetrics tab, and you'll know you're in the right place because you will see all the babies and the belly at then the baby outside the belly at the end there. So the first tab we have here is our delivery stats. We're very transparent with our numbers. And this gives us everything from what's our VBAC success rate to what is the rate of first-time moms having C-sections and the reasons and all that good stuff dating back to 2018. Next is the prenatal care timeline. We're going to click on this because this will give you an idea of what to expect at each visit. So everyone on this call has already had their 8 to 10 week confirmation. Some people had it a little bit later because sometimes it was an insurance holdup. Sometimes we just didn't even know we were pregnant. But the 8 to 10 week visit, you had your confirmation ultrasound. We set the due date. You met with our benefits coordinator. The next visit you have after that is virtual with me, where we go over your medical history and your OB history and decide what blood work needs to be done. Your homework then is to get that blood work done as soon as you can after that. We discuss genetic testing at that as well, and some of you will opt in and some will opt out. And we'll talk about pros and cons at that visit. If you do get the genetic testing done, it's usually done sometime after 10 weeks. And at this point in the pregnancy, we're seeing you every 4 weeks. So about 4 weeks after you did your confirmation visit, you're back in the office to do your OB physical. So you can see we do have lab transparency here. The standard prenatal labs are there in that top middle column. So blood type, blood count, and some serologies. The other part of that panel is 2 columns down, the cervical cultures. The pap test is not part of the routine panel, but if you are due for a pap during your physical exam, you're welcome to have it done, but it's not required because it's not part of the ACOG panel. I have another question out here. What if you weren't given an order for lab work? The order should be given after you have your visit with me. Have you had your virtual history with me? Because if so, at the end of that visit, I typically say you're going to receive an email from our OB coordinator by tomorrow close of business. If you haven't had that visit yet, it should be coming up soon, and then you'll get your order then. All right, so every 4 weeks, so you'll have your OB physical. Those of you who need to see high-risk doctors, usually they start seeing you about 12 to 14 weeks as well. Then about 4 weeks later, you're back in for a belly check. And the next question I have here is, when do I get my blood work done by? As soon as you can. Some of the commercial labs, you have to make appointments, Quest. And so you have to just make the appointment with them and get it done as soon as you're able to. The next question was, I'm a little further along, but I met for a meet and greet and did a genetic test already. Will I still have a meeting with you? If you're transferring in from another practice, you typically will not do another history with me because usually the history is reviewed with the physician that you did the meet and greet with. The next question I have is it okay? I did the labs before my visit with you. The midwife ordered it. As long as all the labs are done, if you haven't had your history visit with me, I'll go over if the labs are already done and I won't reorder them. So it's okay if you entered a little bit late and the midwives went ahead and ordered it. That's fine too. As long as we get them done, that's okay. The reason we try to delay them until you see me is sometimes when I take your history, there's another lab that I want outside of the standard panel that the midwife may not know about yet because she's not taking your history. And I'm trying not to send you back to the lab multiple times to get pin cushioned. All right. So when you come in second trimester for your belly check, you'll talk to the midwife about normal second trimester changes. And then about 20 weeks is when we do the anatomy ultrasound. So you'll see there in the middle mental health screen, we screen everybody, regardless of your history of anxiety or depression, for mental health abnormalities, because pregnancy is full of emotional changes. And we want to make sure that we're taking care of the whole person and addressing any anxiety or depression before it becomes a problem in pregnancy. Then about 4 weeks later, we are looking at doing your glucose test. And I know you all have questions about that. So we're going to put a pin in it. I promise we're going to talk about glucose testing in just a moment. My moms who are Rh negative, if your baby is Rh positive, then you will need ROGAM around 28 to 30 weeks. So we'll try to make sure we get that. If you're meeting with a midwife around that time, she's going to be talking about doula care. You can do your tour of the hospital. This is when we'll give you the information to pre-register at the hospital. And all of that is done online now. No more filling out paperwork and mailing it in. The next question I have here is it okay if our visit with you is after 10 weeks and that's when I get my labs done? Yes, absolutely. Like our goal is to have it done around that time, but we know sometimes the schedules don't line up exactly, but that's our goal. Don't worry, we'll get you back on track for the rest of pregnancy for when we're seeing you. After this 28-week visit is when we start seeing you every 2 weeks. So the every 2 week visits begin, and my moms who have any complications with their pregnancy will begin doing additional antenatal testing. You'll also see over there on the right column, I think you can see, it's not scrolling down for me quite yet, but you can also see vaccines if you are intending to get the Tdap vaccine or booster. Your RSV or COVID booster, those are fine to have in the third trimester, so you'll have time to make antibodies to pass to baby during breastfeeding. We don't do the vaccines here. If you're planning to have them done, you'll either go back to your primary or to a Minute clinic, and we can write a prescription if you want to get them done. You'll also see there in the middle the option to repeat or decline your standard prenatal labs. ACOG recommends doing them at least once. Duval County Health Department recommends repeating them closer to term for certain high-risk populations. If you'd like to opt out of that, just let us know and we can have you decline those as well. We continue the every 2 week visits until about 36 weeks. You'll see there at 33 weeks, my mommies who are planning to have a belly birth, which is our term for a C-section. We try to start getting you scheduled for that date so that you can start planning plane tickets and whatever else family needs to do. And then around 36 weeks is when you come in and start seeing us weekly. That's when it gets real. So we do one more pelvic exam, screen you for group beta strep, and we'll explain why that's important and what that is at that point. And if you've opted out of repeat STD screening in the third trimester, then you also opt out of it with the group beta strep, gonorrhea, and chlamydia repeat. When you start the weekly appointments, you are full term. Yay. And so then you can bring in your birth plan and talk about it with the midwives, start your natural cervical ripening methods. My belly birth moms traditionally will do it at 39 weeks. There are some reasons that sometimes we have to do it before, like around 37 or 38, and that's case by case basis. And then those who are waiting for baby to give the signal for labor, this is the hardest and longest part of pregnancy, but be patient. We want everyone evicted by 42 weeks. So for my first time moms, 41 weeks and 5 days is typically when we would schedule an induction for medical indication. And for my second time or plus moms, 41 weeks and 6 days because your labor is typically shorter. As we go back to the website, first-time moms, just so you know, the average length of labor for you is about 24 hours. So 24 hours is the average. Second-time moms, it's usually about half the length of whatever it was your first time. So some of you have said to me on some of your visits, I have had a headache, I am having this misery, and I can't take anything because I'm pregnant. That is false. If you get a headache, what are you most likely to do? I'm going to reach down here, grab myself some water. All right, polls are closing in 3, 2, 1. Okay, we have more medicators than meditators on the line today. All right, I understand. I'm with you. If you have any pregnancy discomforts, there are some things you can do, and you can click on this pregnancy safe medication to find out what they are. So in alphabetical order, we have listed here on the left some common discomforts of pregnancy. In the middle, you'll see some relief measures. So if you send a message saying, oh, Dr. Adams, I'm so constipated, the first thing I'm going to say is, hey, have you tried everything on the website? And some of y'all are getting smart. You'll send me a message and say, all right, Dr. Adams, I've tried everything on the website. I am still having this problem. Can you please help? And so if you've exhausted everything on here, then absolutely let us know because it may be time for either a referral, some therapy, or a prescription medicine. You'll see over here some things also that we don't recommend in pregnancy and some things to be cautious about. On the second page, for example, you'll see for nausea, if you can't keep down liquids for 24 hours, please don't keep trying things on here. Give us a call because you need something more than what's on this paper. But just remember, all this stuff is out here and you can access it at any time, download it, print it out, and try everything on here before you reach out to us. Next question I have is what about expected labor length for second time moms with prodromal labor the first time? When your actual labor kicked in is what we consider your length of labor. So half of what happened from the time it kicked in to the time your baby was born. The next box you'll see is gestational diabetes screening. We're not going to click on that one right now, but I will refer back to it. So please remember that this box does exist. The next box you'll see is weight gain in pregnancy. So some of you have expressed to me, oh, Dr. Adams, I haven't gained any weight yet. I'm my first trimester and I'm so worried. But meanwhile, your baby's getting bigger. That's because your rates of weight gain are measured in your second and third trimester per week. First trimester is survival mode. You're nauseous, you're sleepy, nothing tastes good, nothing sounds good, nothing smells good. Don't worry. Eat what you can. This, like babies crave carbohydrates. You're going to want carbs in your first trimester. That's okay. Second trimester, you're going to take control, do some parenting, and make that baby eat some vegetables. So, some of you are concerned about how much weight you have or have not or will gain. So, your recommended amount of pregnancy weight gain is based on what your starting pregnancy weight was. So, there's a link on here that you can click on, put in your height and weight, and that will give you your starting body mass index. Based on that, this tells you how much you should gain to support a healthy pregnancy. If you have twins, you can add 10 pounds to the upper number on all of these. But just remember, this is how we measure in second and third trimester how much weight you should be gaining to maintain a healthy pregnancy. All right. The next question I have is Flonase safe for seasonal allergies? Yes. All right. Next box we have there is when we scroll down a little bit, we see birth preferences, and that's what we're going to click on next because many of you will want to make a birth plan. Sometimes making a birth plan just kind of helps take some of the anxiety away from, out of the whole picture, first time moms, especially because you haven't done this before. So there's a lot of things on here to consider, everything from how you want labor to start to how you want to control your discomfort related to contractions. Some things to point out, hydration and food. We don't starve you and strap you to the bed. In fact, we encourage you to move around and be an active participant in your labor. If we scroll down some more, you'll see some other things that are related to positions for labor, positions for pushing, positions for delivery. We do not limit those things, whatever is most comfortable for you in that moment. If you're doing something and it's not working, we might suggest, hey, this isn't, why don't you get on your side, or maybe you try this and you'll have a little bit more oomph. But I mean, our goal is really just whatever you want to try, whatever feels right to you. You'll see on here as well, some of our standard things are perineal massage, warm compresses during pushing. I could probably count on one hand the number of episiotomies I've cut in 22 years. What you plan to do with your placenta. You can also see on here standard medications that are offered to the newborn. You always have the opportunity to bring this in throughout pregnancy and just ask the midwife, well, what is this for? And does this apply to me? And what's the purpose of this as you're making this out? And some of you will work with your doulas to make your birth plan as well. And then you'll see circumcision, breastfeeding for my twin moms. We typically have a delay between twin A and twin B, and so you have some choices about skin to skin and delayed cord clamping there as well. And for my moms who are needing a belly birth, which is our term for cesarean. Again, we do the gentle cesarean, which is family centered with dim lights and patient driven ambient noise and that sort of thing. And you'll have appointments with the physicians to go over more, setting the atmosphere for that as well. So it seems like a lot of stuff to think about. It's 21 boxes. Not all 21 are going to apply to everybody on the call. So take one box per week and then just take your time kind of slowly digesting it and figuring out which points are most salient to you. The next question is, if you don't have morning sickness or nausea, is it true that your hormone levels are low? Nope, just means you're lucky. I was lucky my whole first pregnancy, but not in my second and third. Next question is, are you limited in pushing positions if you opt for the epidural? Only by gravity. Like, we don't tell you you can't get into certain positions, but it's really hard to support your weight when you're not able to feel your legs sometimes. So you're only limited by what your body actually says you can't do, not by what we say you can't do. Cervical ripening techniques, because at some point you're going to want to figure out how to evict this little one or these little ones. So these are things that we've looked up for you across evidence-based articles and information. Starting at 20 weeks, raspberry leaf tea, and you can see then really picks up at 36 weeks, and you can just read evening primrose and breast pump and all of that. So what you see for induction methods, you see breast pump on there. So if you're being scheduled for an induction, we're saying try the breast pump before you get to the hospital. So the breast pump is not typically something that we're doing in the hospital for extended periods of time, because that's something you can do at home for free. Like, don't come do it in the expensive bed for several hours. All right. So the one thing you will not see on here as we go back is castor oil. And you can ask any of your midwives why you don't see castor oil on there. Some of you already know. The next box, listen up, my first time mamas and my moms who have a previous C-section. In fact, how many moms do I have on the line who have had a C-section before and are going for vaginal delivery? There's only one answer here. Either it's not you or yes, and you're going to rock it. We have quite a few VBAC moms on the line. All right, polls are closed. Cool. Okay, for my VBAC mamas, your success is our goal. All right, so this applies to our first time mamas too, because you and the VBAC mamas are doing the same thing, trying to avoid unnecessary C-section. So here is a list of tried and true things that we have done, put together over the years that we've seen give us the highest success rates in terms of achieving vaginal delivery. So everything from for my moms who had a previous C-section and you have a lot of fear surrounding your birth, look for a fear release mediator. We have recommendations for doulas who do those sort of courses. Do your exercises, do your chiropractic care, do your squats, your Pilates. Don't gain more than the recommended amount of weight. Do your acupressure and acupuncture, and then trust your body, and then trust us. Like we're not trying to mess up our stats by forcing you into things that are going to push you toward a C-section. And we've done this thousands of times. So our goal is your goal, is trying to avoid unnecessary things that will probably end up getting you away from what your ultimate goal was. Next one, can TOLAC mamas go till 41 weeks before talking induction with this practice? If you don't have any other issues, you're the same as everyone else. 41 and 5 if it's your first, 41 and 6 if it's your second. So the VBAC isn't a reason to deliver you any sooner. Circumcision care, if you have a little guy and you want to have him circumcised, we do those in the office when they are up to 10 days of age. We do not do them in the hospital. So when he is born, we'll just ask again to be sure that you'd like to have him added to our schedule. And either myself or my partners, Dr. Miro or Dr. Mooney, will be happy to take care of him. And Naisha, our OB coordinator, will send you a portal message with his little appointment time. And you can bring him in and we will love on him. All right, we are headed back to the presentation. So just remember fullcirclejacks.com. All that information is out there for you to access. And next question or next statement, no question, just hoping and positive for a VBAC 2C. Me too, girl. All right, you have a great chance with us, absolutely. Okay, so for those of you who are very concerned about the weight that you've already gained in pregnancy and you can't figure out why because all you're drinking is coffee in the morning, are you? Or are you having coffee in the morning? Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 kilocalories to maintain a pound. And remember that the amount that you gain is based on what your starting body mass index is. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that. So that's wait, hold on. We've skipped ahead a little bit. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that. If your goal weight gain is 25 pounds, that's an additional 250 calories for a total of 1,950. So if we divide that between breakfast, lunch, and dinner, that's 650 calories for each meal. You can eat your 650 calories, but then if you wash it down with a 570 calorie mocha frappa monstrosity, then your body doesn't know the difference. It's just going to be extra calories. Baby's going to keep some of them, and you're going to get to keep the rest. Happy Mother's Day. So just maintaining the calories and making sure that you are eating for two responsibly, because remember, most Americans are already eating for two. It's just something that we do. All right. So, what kinds of things should you be eating? So, you should be eating your fruits and grains and veggies. You're not going to give your baby an allergy to nuts or dairy if you eat those things. So, feel free to go ahead. You can also have deli meats. I think we have a slide for this actually, and I'm not sure if you're seeing the nutrition facts as I am as well, or if you are seeing the other slide, but I'll just keep talking because I've done this enough that I remember. For my coffee drinkers, you can just try to keep your caffeine to less than 200 milligrams daily. Although caffeine, you remember, is a diuretic. So if you're going to drink your coffee, use the 3-to-1 rule. You want to drink 3 times as much water as caffeinated beverage so that you can stay hydrated. Herbal teas are fine, and these are some of our favorites: raspberry leaf, as I mentioned before, ginger, lemon, peppermint. For my vegetarians, vegans, please be sure that you are still getting your 70 grams of protein daily. There are some pregnancy diets that tell you to take 120 grams of protein a day. One, I don't know how, that's so much. And two, you're going to grow an 11-pound baby. Please don't, that's too much. 70 grams is a very good sweet spot for you to maintain your own muscle and to grow a normal sized, healthy baby. You can have deli meat, just be sure that you're microwaving it for 30 seconds to kill any bacteria. In terms of soft cheeses, if they're made with pasteurized milk, you should be fine. If you can't verify if it's a pasteurized milk, like you're at a restaurant or a dinner party, just skip the brie or the blue cheese for that night. For canned tuna, you can have 3 of those 4-ounce cans per week. If you are pescatarian and you need more fish than that, the FDA has a really nice document on their website regarding how much of what type, including things to avoid because of methyl mercury, things to eat in moderation, and then those to eat in larger amounts because they're high in omega 3s or DHAs, which are good for baby's brain development. All right, so things you want to stay away from: fish that is not all the way cooked through, meats that's not cooked all the way through. So, like your steak, you have to ruin your steak for the next 6 months and make it well done. If you like your medium rare steak, like me, this will be torture for you, and I'm very sorry. For my kombucha drinkers, my kimchi eaters, those are fermented beverages, fermented foods. You want to limit those. If not, cut them out. Alcohol, you want to cut out because we do not have an amount that we know is safe in pregnancy. And your sodium, you want to limit to 1,500 milligrams per day. Once you start flipping your food over and realizing how much sodium is in it, you will be appalled at how little you're actually supposed to have every day. The question I have up here actually goes right along with that. Is soy sauce safe? Really, your biggest risk with soy sauce is the sodium. So much sodium, so much sodium. Because y'all start sending me messages, Dr. Adams, none of my rings fit. And the first thing I'm going to ask you is, what did you eat last night? And you're going to say Chinese food and all the soy sauce. And that's what happened. All right. So, no more questions about food. We're going to move on to exercise. So, it is just fine for you to continue your pre pregnancy activity unless your pre pregnancy activity was doing nothing. Then we're going to change that. You just won't feel like doing all the things that you were doing before. In the second trimester, you're going to increase your blood volume by 50%, which increases your oxygen saturations and tensions, and you'll feel more like doing that aerobic activity. So just listen to your body. You will regain your Olympic prowess that you had prior to pregnancy in due time. But I know right now walking across the room makes you winded. It won't be like that the whole pregnancy. It's fine to begin a new regimen in pregnancy. It doesn't have to be anything crazy, but just know that having a sedentary lifestyle leads to malpositioned babies. And the most common reason that I'm doing C-sections is not because babies are too big, not because babies are in distress. It is because babies have crooked heads. They descend in the birth canal this way, or they descend in the birth canal sunny side up. Those of you with these cute little Fitbit watches that are adding a new reason for anxiety to your life. Your resting heart rate, you'll see it going up 10 to 20 beats per minute. That is normal. That is physiologic. That is what is supposed to happen in pregnancy. Unless it's making you lightheaded or dizzy or you're passing out, that is a normal reaction to being pregnant. The next question I have is, what about condiments like ranch and mayo? Are they safe? As long as they've been refrigerated. For the ranch, you may want to look for the low sodium type. And the next question is Reform Pilates safe for pregnancy? We're actually going to talk about Pilates in just a moment. So I'll get to that in just a second. For those of you who are walking for your exercise, please be sure that when you are walking, your heart rate is in the aerobic zone, which is 70% of your max heart rate, which is 220 minus your age. So if you're 30 years old, you start with 220, subtract 30, and you should not be exercising with your heart rate above 190 for extended periods of time. 70% of that, though, is 133. So your heart rate needs to be at least 133 for us to call your walking exercise. So heart rate between 133 and 190 for 30 minutes, 3 times a week, that's aerobic exercise. If when you're walking, you're like casually sauntering around and your heart rate is like 87, that's transportation. That's not exercise. So we'll do something to get that heart rate up, like cardio. You can get on your treadmill, you can use the elliptical, you can run, you can swim. I love swimming because your body is weightless, your joints feel amazing, and you can move around really well. Indoor bikes are fine if you're a Peloton person. I'm off my meds 8, and we can follow each other and put some blue dots on the board. If you are lifting weights, you can lift whatever you're lifting pre-pregnancy. No reason to increase your resistance as your baby and your body will do that as the pregnancy continues. If you are squatting, please do a minimum or work up to a minimum of 50 squats per day. If you're already an experienced squatter, go ahead with whatever you were doing. If you weren't squatting before, you start at 20 weeks, give me 5 a day. 21 weeks, give me 10 a day. 22 weeks, give me 15. Up to a minimum of 50. You can keep going above 50, but a minimum of 50 to get those hips open, as in doing Pilates and yoga. These are 2 of my favorite pregnancy exercises. So Pilates and yoga, anything that makes those muscles long and lean, gets those ligaments far apart to relax. And any experienced instructor should be able to tell you what the pregnancy modifications are for Pilates. The exercises you want to avoid are high intensity interval after your first trimester. It's not the interval, it's the intensity. So you can do the low impact version of these. Anything that has you lying on your flat on your back for excessive periods of time, like excessive ab work. So you can do standing abs, you can do side lying abs, and hot yoga. Unless you're like a hot yoga instructor and you're fully acclimated to that, you want to do just regular yoga because you'll get dizzy and pass out. Scuba because of barometric pressure and decreased oxygen to your baby. High altitude hiking, so up to 8 to 10,000 feet, you're okay. You can visit, but if you're visiting your family in Colorado, you're not going hiking with them. Contact sports, please no kickball or kickboxing during football. Just anything that has stuff flying at your belly, just try not to do. And outdoor biking after 16 weeks isn't a no, but it's a be careful because 16 weeks is where your center of gravity shifts. And you may start to notice as you start to turn corners, you're just falling over instead of actually making it, sailing it around that corner. So now that we've gone over food and exercise, I have a question. Can you prevent gestational diabetes just with diet and exercise? So if you follow all the rules, can you make sure that you don't get gestational diabetes? And my veteran mamas know me. The polls are closing in 3, 2, 1. And that's right. The answer is no. I love that more and more people get this question right the more I do this webinar. You cannot prevent it. And prevent is the key word here. So this is not about family history or your size or judgment on what you eat. Your number one risk factor for gestational diabetes has to do with hormones that are given off by your placenta. So the placenta gives off hormones that tell your insulin it doesn't have to do its job. And the job of insulin is to get rid of excess glucose in your system. So if your insulin is not doing its job, you have extra glucose circulating, and extra glucose is the definition of diabetes, but it's gestational diabetes because it comes from your placenta. So if you can do this pregnancy without a placenta, then I will not screen you for gestational diabetes. But everyone on here has a placenta, and at least one of you has 2 placentas. And so you are at even higher risk for gestational diabetes. Definitely screening you. For my moms who say, but I never eat any sugar, you eat good carbohydrates. So your fruits, your whole grains, don't avoid those prior to the test because you'll give yourself a false positive on it. If it's the actual drink that bothers you, like like you don't like the ingredients in the drink. Don't worry, I got you. We have an alternative for sale here in the office. It's called Simply Pure. It is soy-free, it is dye-free, it is gluten-free, BVO-free, it's kosher, it's vegan, it's offensive to almost no one. We also have, remember that box we didn't click on the website about gestational diabetes? Glucorganics and fresh tests and glucose tablets are also options for patient driven. If you are going to be using one of these, please let your midwife know at the visit because she will need to send you to the correct lab. Quest does not take outside glucose sources. And we have instructions on not drinking it before you get to the lab, all that good stuff. And she needs to write it on the paper that you're going to be bringing your own glucose source. So just let us know if you plan to use one of those other things. All right. Preparing for birth, childbirth education classes. Many of you are planning for unmedicated deliveries, and we do recommend method classes. So what's represented here is Bradley method, hypnobirthing, hypnobabies, Lamaze. So just know that these are some of, again, for informational purposes only, there are many instructors in the city that do amazing work. So not necessarily endorsing anyone over the other. This is just to get you started. Also, we recommend, what's on the next slide, breastfeeding classes. Every new parent should know CPR. So here's a link to the Red Cross to take CPR. If you say, oh, I already know it for adults, it's staying alive, staying alive. But there are different ratios for infants. So it's also good to get a refresher, even if you already know infant CPR. Chiropractic care, we do highly recommend. Just make sure that he or she or they are Webster certified, which is a special pregnancy certification that allows for the different nuances that occur with your body changing in pregnancy. So my next poll question is about doula care. So how many of you plan on working with a doula? And I think you can answer this one now. Go. Polls are closing in 3, 2, 1. Awesome. Okay, well, that makes me happy. Quite a few of you have already decided you're going to work with a doula. Okay, some of you are like, well, what is a doula? Good question. So doulas are there for physical and emotional support. I know you're thinking, well, wait, I have a doctor, I have a midwife, I have a nurse, I need another person in the room? Yes. So they provide emotional support before, during, and after pregnancy, and doulas take one client at a time. So they help you with breathing techniques. They help you to get into positions that are more comfortable during labor. They help you to relax, especially if you have a lot of anxiety about your labor as well. For my VBAC mamas, if you had a position issue with your baby last time, a good doula will help you get in the right positions. You will also see that the very best doulas are the ones that come to you when labor starts. Some of them will even come to your house and then come to the hospital with you when they're sure it's time to come in. They will stay with you all the way through labor, and they are with you until that baby latches. Your midwife at the hospital may have more than one patient in labor at a time, so she may not be able to be at your bedside the entire time, but that doula is contracted specifically with you, and either she or one of her partners will be there with you the entire time throughout labor. Doulas are not medical, so they're not giving you medical advice. They're not providing medical care. They're not prescribing medications. They are not delivering the baby. They are there to help you process your emotions about the recommendations of your medical team. So they are there to help you to talk to us and to advocate for what you're feeling about what's happening in terms of your medical and your prenatal care. Great. So if you want to connect with a doula, ask the midwives. They have no shortage of opinions about the doulas with whom we worked in the past, and they can tell you who we've seen support our patients, our mamas the best. We do also recommend acupuncture and pregnancy massage, and you'll see some business cards that are available when you come out of the bathrooms in the front of the office. All of those are people who we know provide those services for pregnant ladies. When's a good time to select a doula? So really any time is good, but you'll see on our pregnancy, the list of what happens when in pregnancy. It's listed right around 28 weeks. You want to make sure you have her locked in by your third trimester. The next question I have is, if attempting toe lag, should we come in right when labor starts or labor at home until 411? 411 is the how far apart your contractions are for anyone who's wondering about that. So it really depends on the person. I mean, right when labor starts, like if you're contracting it every 15 minutes, you probably don't need to come in. But as it becomes apparent that it's real labor and it's not stopping, then you can come on in. All right, next. I think the next slide is coming up. I'm sorry, I think I have a lag here. Many of your insurances do cover breast pumps, so please do not go and find your own way to get a breast pump. We have found a company that makes it really easy for you and for us. So in every room where you're getting your prenatal care, you'll see a QR code against the wall. You can scan it. Fill in your information. They will contact your insurance, find out which pumps your insurance covers, send you a list of which ones. You can decide which one you want. Then they write up a prescription, send it to us. All we have to do is sign it and send it back. These other companies ask us for what your favorite color was in the fourth grade and all sorts of unrelated information. And then it takes you like 3 months to get your breast pump. This company has a great turnaround. So please, when you're right around your anatomy, ultrasound is a good time to do it. You'll get your breast pump in plenty of time for your baby's arrival. So please just scan our QR code. For those who need FMLA for themselves or for spouses or for family members who are going to be caring for them, we are using Leave Guru, which is a third-party vendor, and Tony is the person who will facilitate you getting the information for that. For anyone who's dealt with FMLA before, you know a lot of times offices will take 10 to 14 days to get you your form if it's filled out correctly. For Leave Guru, what we've been seeing is the forms are completed in about 24 hours or less. So if you need FMLA paperwork done, which is not disability paperwork, but family medical leave, please contact the office for those details. And the next question is, does insurance offer new breast pumps for every pregnancy or only the first? For every pregnancy, actually. Next question, do you also write prescriptions for insurance to cover renting a hospital grade breast pump? So not for renting it, but you can get your own to keep. And many of them are hospital grade. Postpartum care, because one day the pregnancy will end. For my moms who had any issues with blood pressures, we see you back in the office within a week of delivery because preeclampsia is not just prenatal. The most dangerous time for preeclampsia is in the first 14 days after delivery. And so we are hyper vigilant about blood pressures after you deliver as well. My belly birth mamas will be back in 2 weeks for an incision check. We do routine mental health screening because 80% of women will have baby blues, but about 10 to 20% of women may experience postpartum anxiety and or depression, which brings up the point of postpartum doulas. If they're there for physical and emotional support, when do you need a doula more than postpartum? My goodness. So postpartum doulas are a thing, like doulas who are just there for you after the baby arrives. The Motherhood Space is another amazing resource that we have here in Jacksonville. We received a grant. Only 5 cities in the country have this amazing program. And this is housed at the Winston YMCA, and they have group counseling, yoga, paint therapy, walking therapy, sunlight therapy, and psychologists who will speak with you individually. And it can start as early as prior to delivery. And they have free childcare during that time as well, so that you can get away for up to 3 hours a day to take care of yourself. And pelvic floor therapy. We offer that here in the office. So if we are in network with your insurance, so is our pelvic floor therapist. It's a nurse who comes in 3 times a week and just basically helps with some of the discomforts that happen after delivery, whether you have a belly birth or a vaginal delivery, because just carrying the baby around is a risk for prolapse and pain and sexual discomfort and dysfunction after delivery. So we want to help you put things back where we found them. Next question is, I thought doulas weren't covered under insurance. You are correct. And there are some insurances that will give you some, that may give you a stipend. We do have a letter that you can use with your insurance company, but ultimately it'll be their choice whether or not they decide to cover doula care. All right, next. Random frequently asked questions. Yes, you can sleep on your left side, your right side, or your back. If sleeping on your back makes you wake up dizzy, you can get one of those wedge pillows off of Amazon, slide it under one of your hips, and that will keep you from sleeping on your back. You can help paint the nursery as long as you're in a well-ventilated space or wearing your mask. You can take probiotics. You can dye your hair, including your eyebrows. You can wear gel nails. If you're going to be sitting in the salon for a while with the fumes, you may want to wear a mask just so you don't get dizzy with that. For car travel, you guys are going to be pregnant over the holidays. So you can travel up to 37 weeks, just because after that, like it's safe after 37 weeks, but you might go into labor and have your baby with strangers, and you don't want to do that. You want to do it with full circle. Just be sure you're getting out and stretching every 2 hours to keep your blood circulating, which you'll have to do anyway if you're drinking the right amount of water. For skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. You need a retinol alternative. Bakuchiol, Bakuchiol, is found in many natural products, and it is a vitamin A alternative that doesn't have the harmful effects to your baby of retinol. You can fly in an airplane for my twin mamas up to 32 weeks. For my singleton mamas up to 36 weeks. Just please, please, please be sure you are wearing compression hose and doing your toe raises to exercise your calves and drinking lots of water to prevent yourself from getting blood clots in your legs that can travel to your lungs. The question I have here is what about flights? And yeah, I just answered those. And are long flights safe? Yes, still flights. Just again, compression hose and toe raises and water. What do you want to stay away from? Roller coasters and water slides. Pretty easy. All right, our last thing here, the next question I have is, start wearing compression socks now or in second trimester. You can wear them at any time, but specifically when you're going to be on an airplane, I want you to wear them for sure. All right, COVID, and then we're done. For vaccinations, ACOG moved from supporting either way to strongly recommending them after studying 35,000 pregnant women in April of 2021. You can read about it in New England Journal of Medicine. You can take the Moderna or Pfizer vaccine, but not Johnson & Johnson because of its independent risk of blood clots and the pregnancy risk of blood clots. All of them are approved for boosters. If you're 6 months past the Moderna or Pfizer and want to get one for your third trimester to protect your baby, absolutely. If you're 2 months past the Johnson & Johnson, you can get you can get a booster, but not Johnson & Johnson because you're pregnant. But mixing and matching is okay, so you can get a Moderna or a Pfizer. There's no optimal time versus getting your flu vaccine, your RSV, or your Tdap because all of these vaccines work differently. If you do contract COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. But what we do recommend are vitamin D, vitamin C, zinc, in the doses that you see on here. We also recommend starting a baby aspirin, the 81 milligram chewable ones, if you contract it before 36 weeks. If you get COVID after 36 weeks, don't start the baby aspirin because you'll increase your risk of bleeding at delivery. Because we've seen COVID and pregnancy associated with high blood pressure, we do start serial growth ultrasounds to make sure that baby's blood connection and blood supply is still good after COVID. If you need work from home letters to around term to keep you from getting COVID around the time of delivery, we're happy to provide those as well. Just let us know. If you are COVID positive, please don't come to the office. Please don't come to the office. Please don't come to the office. You're going to get us all sick, and then there will be no one to deliver your baby. We will convert your visit to a telehealth, but we ask that you just please protect the other immunocompromised pregnant women in the office, as well as my staff, one of whom is an immunocompromised pregnant woman. For those of you who had your babies during the height of COVID before, take a deep breath. We are back to our pre-COVID situations. You can have your 4 visitors again, plus your DONA certified doula. We're not having anyone mask in labor unless you are actively COVID positive at the time that you are delivering. And if you have COVID when you deliver, we do not separate you from your baby. You're given an isolette so baby's not exposed to your respiratory droplets, and you're given N95 masks and encouraged to breastfeed. All right, what information can you find on the website? Can you find the template for the birth plan, safe medications in pregnancy, what to expect at each visit, or are you a stellar test taker and you know that reading all the answers is key? Fantastic. This is the end. You guys were amazing. Thank you for asking questions the whole way through. If there are any other questions, please feel free to drop them in. As I remind you that we are social, so follow us on all the things. We are on Facebook and Instagram and X, formerly known as Twitter. YouTube is where you'll be able to find the playback for this for the duration of your pregnancy. And remember our series In Her Words. So when you tell your rock star birth story, we are excited to publish publish it and share what an amazing birthing mama you were. Thank you for your time today, guys. Thank you for choosing Full Circle, and we'll look forward to seeing you back in the office really soon. Bye.